Hello there, good evening to you. They've been diagnosed with dyslexia and find reading a real struggle. So, could an eye test and computer programme be the answer?
Today, the government pledged £10 million to give extra help to children with dyslexia and literacy difficulties. Education Secretary Ed Balls promised the money for specialist teaching and support for schools and parents.
But one clinic here in the south wants the government to go further and introduce a test which could detect a treatable eye condition. Now, convergence failure is when the eyes fail to work properly at close range, but if treated effectively, it could help children improve their reading. Our health correspondent Stacey Pauc has been finding out more.
1 in 10 children are diagnosed as dyslexic.
I find it very hard to understand.
I'd have to read it, then reread it to understand it.
I didn't understand what I was reading because I was concentrating on reading.
Dyslexia means difficulty with words, but this local practitioner feels it's often not words that are the problem, but vision.
Somewhere in the region of 30% of children have a problem in bringing their eyes in towards their nose, what we call convergence. Now, for anything that you're doing close up, reading, doing your sums, whatever, you've got to bring your eyes in and hold them there. And if you're reading, you then have to take them to and fro, left to right, smoothly, in order to be able to get the words off the page. Now imagine if you can't do that, the struggle you're going to have. If you hold that, look up in front of you.
At this centre, they've devised a test where the exact eye movements are recorded. So as Jack reads this passage, his eye movements are being monitored. And if he's going back over words or reading backwards, it's shown up by the red cursor.
It highlighted that 41% of his reading, he was reading right to left as opposed to left to right, which illustrated why he was in the bottom group at school for English and his comprehension was so poor.
I'm enjoying reading now, it's just a lot better.
And do you understand it, Mum?
Yeah.
Once the problem has been identified, a simple computer programme can put it right. What the children are seeing when they're doing this test is this 3D cube, which they have to track as it moves around the box. Now, if their eyes aren't converging properly, which Georgina's weren't, they'll just see a blank box, exactly what we're seeing here, because we're not wearing the 3D glasses. And as their ability to see the image improves, the box moves quicker, making their eyes work harder and harder.
I would say within an actual few weeks of doing it, she's starting to get better, and then a few months later we had a letter from the school to say she'd gone up by about 2 years in her reading.
What did your teacher say at school?
They were wondering what I was doing and how I was improving.
It seems so simple, making sure the eyes are working properly first before you label the child as dyslexic. So that's why parents are calling for this test to be part of the preschool eye test.
If it was picked up in preschool children before they start school, then the problem can be dealt with much earlier, as they're learning to read.
No one is saying this is a cure for dyslexic children, but it certainly helps a significant number. And to know that, you just need to ask the children.
I'm in a centre at the moment and there's people who don't come here. So I think they should.
Stacey Pauc for Meridian Tonight.
Fascinating. Meanwhile, the Children's Hospice Naomi House, which lost £6 million in the Icelandic bank collapse,